चलिए आपको सीधा लिए चलते हैं वीडियो कॉन्फ्रेंसिंग में, जहां प्रधानमंत्री नरेंद्र मोदी सार्क देशों से वीडियो कॉन्फ्रेंसिंग के जरिए कोरोना से निपटने को लेकर चर्चा कर रहे हैं।
For discharge of cleared cases, we also responded to the call of our people abroad. We evacuated nearly 1,400 Indians from different countries. We also similarly helped some of the citizens of our neighboring countries. We have now built a protocol for such evacuations, including carrying out testing by our mobile teams deployed abroad. We recognize that other countries would be also concerned about their citizens in India. So, we briefed foreign ambassadors about the steps we were taking. Excellencies, we fully recognize that we are still in an unknown situation. We cannot predict with certainty how the situation will unfold despite our best efforts. You must also be facing similar concerns. This is why it would be most valuable for all of us to share our perspectives. I look forward to hearing your views. Thank you. Thank you very much. I now request His Excellency President Ghani to share his thoughts with us.
Thank you, Mr. Prime Minister. Again, best wishes to Prime Minister Oli, and thank you for taking this very important initiative. All that is normal is disrupted, and all that seems solid is melting into thin air. We are into unknown territory, and our vulnerability, Excellency, comes from our openness. Our greatest vulnerability is that we have an open border with Iran, one of the major centers, and the flow cannot be stopped. And the province of Iraq is become the central node for preventing the spread and diffusion of this deadly disease to the rest of South Asia. I have the following 5 proposals. Mr. Distinguished Prime Minister, since India is both a very important member of SAARC and a member of the Shanghai Cooperation Council, in Shanghai, both with China, that is our deepest sympathies, in Iran. Can we coordinate between SAARC and the Shanghai Cooperation Council through your initiative? How much of the experience of China is replicable to our situations, and how do we both learn and help Iran? I thank you again for this opportunity. Our conditions, being one of the poorest countries and conflict-prone, require learning, particularly from how you upscale the existing program. We have a program across the country called Health, that is basic health. And if there are other countries that have upgraded their basic systems to cope with this, we'll be extremely grateful for learning and yet sharing our experience. Thank you, Excellency.
Thank you. Thank you, Excellency. I now request His Excellency President Soli to make his remarks.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon. I too wish to begin by thanking Prime Minister Modi for this timely call for a regional initiative to combat the increasing threat of COVID-19 in the SAARC region. In times of crisis, we do come together. In 2003, for example, when the region faced the threat of SARS, the Maldives took the initiative and hosted an extraordinary meeting of SAARC health ministers that adopted a regional common strategy for tackling the virus. No country on its own can succeed in combating the virus. It requires a shared response at an unprecedented scale. The first COVID-19 case was confirmed in the Maldives on 7 March. To date, there are 13 confirmed cases. Fortunately, no deaths so far. Since January this year, the Maldives has been taking steps to get ready for a possible outbreak. We set in place standard operational procedures and facilities for treatment and quarantine in various islands. In the event of major outbreak in the country, our health facilities will have to cope with the care needed for both our residents and the thousands of tourists who visit the Maldives every year. Our priority now is to use precautionary measures to contain the virus as much as possible so as not to overburden our limited resources. The unique geography of the Maldives will always present itself both as an opportunity as well as a challenge. The dispersed islands make it easier for us to isolate communities whenever there is a suspected case. But in the event that a person tests positive in the outer islands and is seriously ill, requiring specialist care, the person has to be transported to the capital, Male. This is extremely costly and puts enormous pressure on an overstretched team of healthcare workers. For tertiary hospitals, regions are currently